Well, hi everybody. My name is Dr. John Hayes, and I'd like to welcome you to the first edition of Beating Neuropathy and Chronic Pain on 95.9 WATD. And what I thought I would do is to, first of all, try to connect myself with you as the listener, tell you a little bit about myself, what I'm doing here, how this whole thing came about, because it's been very, very interesting. First of all, as I said, my name is Dr. John Hayes. I'm a chiropractic physician by training. I have additional postgraduate work, so I'm a board-certified chiropractic orthopedist. I also have a master's degree in clinical nutrition. I've been a consultant to healthcare private practice professionals since 2005, in private practice since 1981, and that's kind of how I got involved, of course, in treating patients, and the rest, as I say, is history, but a very, very important history when it comes to this entire topic of chronic pain and neuropathy. We do want to talk about what neuropathy is, of course, but more than that, I think probably one of the first things we want to emphasize is what a difficult and very, very significant problem chronic pain has become in our society. The fact of the matter is that there are well over 100 million people that suffer recurring or chronic pain. That means pain that we live with on a daily basis. It is an enormous drain on the financial resources. Not to even mention the lifestyle disruption, the family disruption, and so on and so forth. The actual devastation that chronic pain really has in our society. And that really is going to be the focus on our show, and that is bringing to you what the best methods of treatment are for these conditions. And of course, being a chiropractic physician, I tend to lean towards the more conservative routes. But, as I tell patients all the time, my most important thing for them, as it will be for you, is what works best. What works best for you is what we're going to want. So that, I guess, kind of sets the stage for what we're all about and what our goals are, what we're going to try to accomplish. I think probably what I'd like to do next is to talk a little bit about the neuropathy problem, talk about the neuropathy story. It's a very, very interesting story, and I'm going to tell you a little bit about how I got involved in this whole thing. Back in 2008, I was conducting a seminar for physicians in Marina del Rey, California, and I had a couple of my physicians come to me during that weekend and said, Dr. Hayes, I've been recently marketing to help patients with nerve pain and chronic pain and neuropathy, but even though I'm doing a good job of getting these patients to my office, my results aren't always as consistent as I'd like them to be. Do you think maybe you could do a little research and help me out? So I said, sure, I'd be more than happy to, and I added that to my list. And a short time later, I was back in the office and had a very, very similar phone call from another client in South Carolina, another doctor who basically repeated the same story. Right around the same time, my brother-in-law's mom basically came to me through my brother-in-law Don, who told me that she had been suffering from a condition called diabetic neuropathy. And for those of you who don't know, diabetic neuropathy is an extraordinarily painful condition. It's life-disrupting, to say the least. If you have it or know somebody who has it, you don't need to know anything more about it, except the good news is now there's a lot more that we can do for patients that suffer from peripheral neuropathy. But basically, what neuropathy is, it's a form of chronic pain. It is a condition that attacks the nervous system, and we're talking now primarily about the peripheral nervous system, that is the nerves outside the brain and to a large extent outside the spinal cord. And really what happens is that when the nerves are damaged, whether it be from diabetes, chemotherapy, and a whole host of other conditions which we're going to talk about, the net result is these patients really suffer tremendously. Loss of sleep, loss of sensation, loss of balance, tingling, numbness, pins and needles. It's a condition that oftentimes tends to creep. In other words, it can start up very gradually and it can progress. In the case of diabetes and diabetic patients, it can progress rather slowly. So what starts off as just a simple annoyance, 5, 10, 15 years down the road can be absolutely devastating. And the sad fact is that we're seeing, many more of these cases because the incidence of diabetes is increasing dramatically. And another population of patients that gets neuropathy frequently are those patients who have undergone chemotherapy, primarily due to cancer or other health conditions. But neuropathy can also be caused by a number of different things. Unfortunately, there are some medications that can cause neuropathy. Cigarette smoking can cause neuropathy. Basically, anything that causes what we call hypoxia, or loss of oxygenation to the body's tissues. This can occur in patients that have had multiple surgeries. It can occur in people that have had cardiac events or heart disease. In other words, if you have a heart attack and recover from the heart attack, there could be a period of time where you have oxygen deprivation. All these things tend to be cumulative in our experience, and it is the cumulative effect of all these things together that we see in the clinic that results in neuropathy and results in chronic pain. So that really is the kind of a nutshell, if you will, of what neuropathy is. And of course, chronic pain can be due to a number of different conditions. But as a clinician, one of the things that concerns me the most, and concerned me right from the beginning when I started to treat neuropathy patients, is the simple fact that there are 20 million patients alone in the United States. There's several thousand new cases per year, and there is no good medical treatment for peripheral neuropathy. Now, as it turns out, there are some combined treatments that are and can be extraordinarily helpful much of the time, and that's going to be the focus of this show and the next show as well. So with that said, I think what I'd like to do next is to, first of all, say right from the start that this show is intended to be about you. And if you do have any questions, we want you to get them to us. And the best way to get questions to myself and my team is through email. You can send us an email to neuropathydoctor, that's neuropathy, the word doctor, spelled out, at gmail.com. So that's neuropathydoctor@gmail.com for any of your questions, and we'll be sure to get the answers on the air as we revisit you every week.